There are 5 main issues that can be present for you to be having stress urinary incontinence. One is pelvic floor weakness. So the muscle is actually too weak to support the bladder or the sphincter. This can happen in people who have and have not had babies. This is not a specific thing to postpartum individuals. But just like any other muscle, our muscle needs to be able to be strong enough to complete the task. The other one is decreased speed and coordination. So our muscle can be really strong, but it may be slow, or it may be missing the message that it's supposed to click on before a cough, a sneeze, a laugh, or landing from running or jumping. So if the muscle is not contracting in time, it's not counteracting that force in time. So our muscle can be really strong when we're sitting here thinking about it, but if it's not doing its job automatically, and these muscles are automatic and reactive, then we're gonna have leakage. The other one is that urethral hypermobility that we talked about. So there's soft tissue that holds our urethra in place that is different than muscle. Sometimes that urethra is moving around a little bit too much after we've had a baby or maybe a pelvic surgery, something like that. The other one is increased pressure down. So it may not be a support issue up, but a pressure issue down. So things like the way that we hold ourselves in posture, the way that we may be holding our breath to do something, like if I grunt to sit up, like that's increasing pressure down, or if I'm doing that same thing when I am running, picking up something heavy. The other thing is that we're just not allowing enough shock absorption with running or jumping. So if we have weakness in our legs, like our thigh muscles, our quadriceps, our hamstrings at the back of our legs, or our glute muscles, our butt, all those muscles are supposed to be helping us absorb shock as we land from running or jumping. If we're not absorbing shock, then our pelvic floor is doing all of the shock absorption, and that's not its job. And sometimes that's gonna cause leakage. Now, we talked about the pelvic floor being able to contract, close, and lift, but normally all throughout the day, we want it to be kind of nice and relaxed like a trampoline, where it has a little bit of tension, but then it can bounce up if we need it to. If it is always holding up high and tight, trying to stabilize because we have some weakness in our other muscles, then we can also have leakage. So an overactive pelvic floor can also cause leakage. I tell people to think about if we throw a water balloon on the concrete, that concrete has no give and the water balloon is going to break. But if we throw a water balloon on a trampoline, a lot of times it's just going to bounce because there's a little bit of give to it. So we want the same thing with our pelvic floor muscles. We want it to be a little bit of tension at rest, but we can fully relax it and then fully contract it, both volitionally and automatically. A lot of times when we're having leakage issues, we're having issues with the automatic muscle contraction. So it takes practicing something over and over again, multiple days, multiple weeks, to get that automatic contraction back. So it's not always a weakness issue, sometimes it's a tightness issue, and a lot of times it's a coordination issue.